Hello, my name is Amanda Hoon. I'm a registered dietitian with WellSpan Bariatric Surgery in York. Today we're going to talk about Nutrition Session 8, and in this session we're going to put your beverage to the test. We're going to determine if your beverage is actually hydrating you or if it's potentially causing dehydration or leading to or contributing to excess calories that you're taking in. In Nutrition Session 4, we learned about the ideal beverages to consume. Those beverages should be low-calorie or calorie-free, non-carbonated, and be decaffeinated. Over the past 25 to 30 years, Americans have been consuming up to 300 more calories per day from beverages like sports drinks, energy drinks, fruit juice, milk, coffee drinks. The concern with this is that these beverages are contributing excess calories, potentially leading to lack of weight loss or even weight gain. To determine if your beverage contains calories, it's best to use the nutrition facts label to determine if your beverage contains calories, particularly those calories are going to come from sugar. So this board demonstrates how many teaspoons of sugar are in certain beverages or different beverages. For instance, in the vitamin water, the original vitamin water, there is 32 grams of carbohydrate or sugar, which is equivalent to 8 teaspoons of sugar. So for every 4 grams of carbohydrate, it's equivalent to 1 teaspoon of sugar. So again, 1 teaspoon of sugar is equivalent to 4 grams of sugar, if you were to read it on the food label. These baggies represent how much added sugar is in all these different products, whether it be sports drinks, sodas, energy drinks, and sweetened iced teas or lemonades. Compared to the carb content or the added sugar content of skim milk, the Premier protein shake and the Muscle Milk protein shakes, and also the Powerade Zero that is 0 carbohydrate or 0 calories, as it only contains electrolytes. Now, your body does need sugar in order for it to properly function. However, there is only so much sugar that your body actually needs. Once you've consumed an adequate amount, the rest is then converted to fat and stored in your body, contributing to weight gain or lack of weight loss. So these beverages may quench your thirst, but they're not going to fill you up or satisfy you the way that a meal would. Drinking a high-calorie beverage doesn't necessarily mean that you're going to eat less at the meal to compensate for the calories that you consumed from the beverage. In order to determine the calorie intake from your beverage, again, use the nutrition facts label, but also measure out the portion that you had so that way you can then, using the information on the label, determine how many calories you actually consumed. For instance, if you had a 16-ounce bottle of soda, 8 ounces of that bottle of regular soda might be 150 calories, but you drank a 16-ounce. So now that 150 calories becomes 300 calories, significantly more than what you may have initially thought. After surgery, one of your post-op goals is to stay hydrated by consuming 8 cups or 64 ounces of fluid every day in order to prevent dehydration. Dehydration can disrupt your body's normal metabolic processes, leaving you feeling terrible. Symptoms of dehydration include thirst, dry mouth, fatigue, weakness, decreased urination, dark urine, instead of a pale yellow lemonade color. You might have some dry skin. You may experience headaches, dizziness, and even constipation. More severe symptoms of dehydration include if you're not urinating at all, your eyes are sunken in, your skin is shriveled or cracked. Maybe you start experiencing low blood pressure, rapid heart rate, rapid breathing. You may have a fever, but generally all of this is going to mean that you're going to feel confused. None of these symptoms are obviously anything that anybody wants to experience, so it's best to carry a water bottle with you, constantly sip, constantly drink throughout the day. The problem is, as we talked about in Nutrition Session 4, you also have to keep in mind that 30-30-30 rule. With that 30-30-30 rule, you're not to stop drinking a half hour before the meal, don't drink with the meal, take a half hour to eat it, and then wait 30 minutes after you're done eating before you would start drinking again. Okay. If you're doing that for 3 meals a day, that's 4.5 hours out of your day where you're not going to be able to drink. This then can be compounded by the fact that you can't drink a whole lot immediately after surgery. So now you have to constantly be sipping on fluids throughout the day in order to prevent this dehydration. Your goal is to achieve 64 ounces of fluid a day. Okay, at minimum, 48 ounces would be a good starting point, and then as you feel comfortable tolerating more and more, try to attain the 64 ounce, or try to consume the 64 ounces of fluid a day. Okay, again, constantly have a water bottle with you. If you need to, you can get a water bottle that is insulated so it can keep your beverage cold, it can keep your beverage warm, or if you're okay with something that's room temperature, that's fine as well. So as we mentioned in nutrition session 4, the ideal beverages are low calorie, calorie-free, non-carbonated, and decaffeinated. So beverages that contain 10 calories or less per 8 ounces is what you're looking for. If your beverage is 0 calories per serving, that's even better. But as a maximum, set your parameter to 10 calories per serving. No more than 10 calories per serving. 0 calorie or low calorie beverages include those that are typically artificially sweetened or they're considered diet, like diet lemonade, diet iced teas, flavored waters. There's one called Hint. Or you can use, there's plenty of water enhancers. Different brand names include Crystal Light, Mio. There's a product called Circle, where it's a flavor packet that's infused into water. So again, you have plenty of options for flavoring if you find that plain water isn't your go-to beverage. And any beverages that are artificially sweetened, with Splenda, Sweet and Low, Equal, those are all appropriate for this purpose. They may not be beverages that you choose to consume, but they are appropriate for this purpose as they don't contain calories. So be careful with beverages like fruit juices. Fruit naturally has sugar in them, but then the natural version of those fruit juices are not necessarily the best tasting. So to make it taste better, sugar is added to it to improve the flavor. That added sugar is going to add a lot of extra calories. The downside to that is you get all those extra calories, but then you don't get the nutritional benefit from the juice or the fiber content that actually eating the fruit would have. So if you're looking for something sweet, you can try a piece of fruit instead of drinking the juice, and that way you actually get the nutritional value. You still get calories from the fruit, but at least it's got some fiber content and vitamins and minerals versus added sugar that's going to be converted to fat and stored. For those that may be diabetic, oftentimes fruit juice is something that's consumed in order to raise your blood sugar. If you are still diabetic after surgery, 4 to 8 ounces of fruit juice may be appropriate to use. If you're unsure, please make sure you contact your bariatric surgery office, and we can help you find a more appropriate way of bringing up your blood sugar if that's the case. Especially if you've had the gastric bypass, you don't want to have too much juice and end up actually having dumping syndrome because you already don't feel very good, so you don't want essentially to make that worse. So the next component of our beverages is to have, in addition to them being low calorie or calorie free, you also don't want a beverage to have any bubbles. You have a much smaller stomach after surgery, so those bubbles or that carbonation can actually irritate the stomach and cause gas and pain and pressure. So carbonated beverages like soda, seltzer waters, carbonated waters, energy drinks, there's certainly more than that, but at least those are the primary beverages that most will consume. So even though those beverages may be calorie-free, they still have little to no nutritional value. Okay. And those bubbles can irritate the stomach, making you feeling gassy, uncomfortable, burping a lot. Okay. The carbonation can also contribute to making heartburn worse. Okay. So for those of you that may be experiencing some heartburn, if you're drinking a carbonated beverage, maybe decrease that or eliminate it altogether and see if that resolves the heartburn or at least improves it. Regardless of the calorie content, so whether you were to have regular soda or diet soda, it doesn't really matter that you're having regular or diet. The carbonation, the bubbles, is the problem. So that's what you would want to eliminate prior to surgery. So another component of the ideal beverage is having a beverage that doesn't have any caffeine. So caffeine, unfortunately, can irritate the stomach. Okay, so again, with a bypass, you have a stomach about the size of an egg, so really tiny stomach. With a sleeve, you have a stomach the size of a banana. With those two smaller stomachs, you have potential that caffeine can irritate the staple line and cause some what we call stomach ulcers. Okay. In addition to the potential for developing ulcers, the caffeine can also, caffeine acts as a diuretic. So if you're not always used to having caffeine on a regular basis, the caffeine will possibly make you go to the bathroom more frequently. Again, we've already talked about this. You have a much smaller stomach, so if you can't physically put a whole lot of anything in your stomach, it's going to be very difficult for you to maintain hydration, especially if you're having something that's going to make you urinate more frequently. You're not going to be able to compensate for what you're urinating because you're taking in something that's making you go to the bathroom more. So you want to make sure, again, you're constantly drinking throughout the day. Your beverage doesn't have a whole lot of added calories to it. It doesn't have any carbonation, and it doesn't have caffeine. Now, for those of you that are diehard coffee fans and you need your coffee fix and you need your caffeine fix, this is temporary. Once you get to the point where you are capable of drinking the 48 to 64 ounces of fluids regularly, consistently every day, this may take somewhere between 6 weeks and 3 months after surgery before you can actually do that. So once you're able to actually drink enough to stay hydrated, you can then incorporate, I would start with maybe 1 8-ounce cup of coffee. Okay. You can try to reintroduce that and see how you feel. Okay. If you find that you're able to drink enough to stay hydrated, you can certainly continue with your cup of coffee. Now, some patients do find after surgery that they don't have the desire for coffee anymore. They got their energy back from the weight loss that they've experienced already. Some find that coffee doesn't even taste the same to them. They don't like it as much, or they just don't care for it anymore. So keep in mind that just because you like coffee right now doesn't necessarily mean that it's going to be your go-to beverage afterwards. Once you are able to reintroduce a cup of coffee, try to limit it to no more than 2 cups of coffee per day. Okay. That would be the equivalent of about 400 milligrams of caffeine. Okay. You want to be careful that you're not consuming too much caffeine because it can lead to insomnia, headaches, restlessness, upset stomach, a rapid heartbeat, muscle tremors, rambling thoughts. It can intensify anxiety. So you do want to make sure that if you are having coffee that, especially since it's been several weeks since you've had it, you may want to gradually have it or gradually try it, just so that way you can see how your body reacts to it now that you've actually had surgery. Right now, prior to surgery, if you're regularly drinking soda, caffeinated beverages, high-calorie beverages, energy drinks, if you're drinking something that we've kind of talked about aren't necessarily the ideal beverages, now would be the best time to start either decreasing the consumption of them or even working towards eliminating those beverages. So that way you find an alternative that you like and it becomes a little bit more routine. So that way when you do get to surgery, you're, again, not trying to change everything all at once and feeling overwhelmed. So for beverages that meet the criteria that we've talked about, so beverages that are low calorie, calorie-free, non-carbonated, decaffeinated, those would include obviously plain water, Crystal Light, Mio, herbal teas, diet unsweetened iced teas, diet lemonades, fruit-infused waters, Powerade Zero, Gatorade Zero, Propel Fitness Water, Vitamin Water Zero, Sobe Life Water Zero, skim milk, 1% milk, soy milk. All right. If you decide that you're not a huge fan of plain water, so if you wanted to add a water enhancer, I would start with, instead of a whole packet of Crystal Light into a 16-ounce bottle, maybe just start with a small amount of it. Shake a little bit of it into the bottle, shake up the water, try that, see if you like it. And that way you can add more to taste. And you can determine, what amount of additive, whether it be the Mio, the Crystal Light, or even the Circle infusion bottle. You can determine what amount of flavoring is best for you. If you are considering fruit infusions or infusing something into your water, some of the more common additions to water are mint, berries, cucumber, or even ginger. And that all you would have to do is take some fresh berries, cut them up, and put them into your water bottle. Okay, same thing with cucumber or mint. You don't have to do anything extra special. You just, clean the berries or the mint and then put that in your water bottle. So I kind of alluded to this earlier. One change that may happen after surgery, aside from the fact that you may or may not like certain artificial sweeteners, or you may not care for water, or I mentioned the coffee you might not care for. So another consideration is the temperature of your beverage. Some patients find that after surgery they tolerate room temperature water better, or hot beverages better, or cold beverages better. So again, if you find that you have a preference for one temperature or another, you may want to consider a water bottle that's either thermal, so that way it can keep the beverage hot or cold, or if you're okay with just a standard water bottle that allows the beverage to be room temperature. So we've talked about a lot of beverages. I want to kind of hone in on some more specific ones, just to go over a little bit detail as to why certain beverages are not appropriate for this purpose. So sports drinks like Gatorade Zero, Powerade Zero, the Propel Fitness Water. So those are beverages that were initially designed for athletes. They're specifically designed for athletes. The original versions of those products contain carbohydrate or sugar, because it's your body's main source of fuel. So to fuel an athlete, you need to have sugar. Okay. And those beverages also contain electrolytes, sodium, potassium primarily, and some others. Okay. So unless you're doing a 60-minute high-intensity physical activity or you're sweating profusely, it's not likely that you are going to need the calorie content or the electrolyte component of those sports drinks. Okay. Keeping in mind that electrolytes, your body certainly needs sodium and potassium and the other electrolytes. However, if you have too much, that can cause an electrolyte imbalance and subsequently contribute to other conditions or a not so pleasant feeling. Okay. So unless you're doing those high-intensity activities or you're excessively sweating, you don't need to have the Gatorade products or the Powerade products. Certainly not something to be having as your go-to beverage on a regular basis. Now, after surgery, there are some instances where you may experience, maybe you experience some frequent vomiting or diarrhea. And in that case, you might need to have some electrolyte replacement. You don't need the carbohydrates or the sugar, so the zero versions of those products would be okay. So Powerade Zero or Gatorade Zero. Those products don't contain the carbohydrate or the sugar, but they do have the electrolyte component. Okay. If you feel like maybe you're out for a walk or you're sweating, during the summertime, if you do feel like you need to have a little bit of sugar content, G2 would be an option as a compromise. But again, keep in mind, the G2 product still has carbohydrate, so it could contribute to dumping if you've had a bypass, and it still contains calories. So it isn't necessarily a beverage that you would want to drink as your exclusive beverage. Okay, so sports drinks should never be used as your exclusive beverage in replacement for water. So another very popular beverage is specialty coffee drinks. I call them foo-foo coffee drinks. They taste really good. They've got all the sugar added to them, all these flavors and great flavorings for all the different seasons. But with those great tasting beverages come a ton of calories. And it's not, coffee in and of itself is practically calorie free. The calories are coming from the sugar that's added to it, the milk that's added to it, or the cream that's added to it. It's the syrups, the chocolate syrup, the caramel syrup, the pumpkin pie spice flavoring, the peppermint spice flavoring, the mocha, like chocolate syrup or caramel syrup. All that adds to all these extra calories. Again, to make it taste good. But the cost is 300, 400, 500 calories. You get some of these big coffee drinks that are, 20-ounce coffee drinks. It could be 1,000-calorie beverage. Okay. So that caffeine, that amount of caffeine can irritate your stomach. The calories can contribute a lot in terms of compromising the weight loss that you're hoping to experience, or it can even lead to weight regain if it's been some time since surgery. Okay. It may give you a boost of energy, but the impact is going to be much greater in terms of calorie content. Okay. So there's some ways that you can at least work on decreasing the calorie content of a specialty beverage. Obviously, instead of having the 20-ounce beverage with the potentially 1,000 calories, having the smaller 16 or even 8-ounce container will subsequently have less calories. But then to ask if, when you're having the beverage made, see if there's a sugar-free syrup version that you can have. That would be, still give you the same flavor. Obviously, it doesn't necessarily have the sweetness to it, but then you can use the sugar-free syrup and add Splenda to it to compensate for what the sugar would have, the flavor that the sugar would have provided. So instead of a 1,000-calorie drink, you might have a 300-calorie drink. Okay, still 300 extra calories, but significantly less than the 1,000 that it could have been. Okay. If you're making coffees at home, there are sugar-free coffee syrups that you can get to add. So sugar-free creamer is another option, but sugar-free creamers are great in terms of providing the flavor that maybe you're looking for, but just because they're sugar-free doesn't mean they're calorie-free. A lot of the sugar-free creamers are 15 calories, 25, or even 35 calories for 1 tablespoon. So if you're not measuring it out and you're just free pouring into that coffee and you like a little bit more creamer than you like coffee, you could still have a 300, 400, 500 calorie coffee. Okay, so be careful that if you're using creamer, you're measuring it out. Or if you're using the sugar-free syrups, again, you can try the sugar-free syrups and add Splenda or an artificial sweetener to compensate for you. There's a couple different brands of sugar-free syrups that you can purchase from coffee shops, grocery stores, Walmart, Target, or online through Amazon. And those brands include one called Torani, Da Vinci, and Jordan Skinny Syrups. So those are all sugar-free. Most of them are actually calorie-free too, but they're much different from the sugar-free creamers, as the creamer is milk-based, so that's where you're getting the calories from. Then you also have to consider not only the creamer you're putting in it, the syrups that you're putting in it, the whipped topping that you put on it. Depending on what the whipped topping is made out of, that will contribute a decent amount of calories. So if it's skim milk, almond, soy milk, all of those are going to have much different calorie content than the cream that's made with whole milk. Okay, so you can still enjoy specialty coffee drinks. You just need to be careful as to what the recipe entails, what's all included in it, and try to avoid those beverages that are 1,000 calories or more. And also be careful that you're not frequently drinking caffeine so that way you can maintain your hydration. You want to make sure that you're able to get enough 48 to 64 ounces over the course of a day and that way the caffeine isn't potentially contributing to frequent urination where you can end up dehydrated. The final beverage that I want to discuss with you is alcohol. So, point of contention in some cases. However, alcohol you absolutely have to be careful with. So, alcohol in and of itself contains calories. Okay, there's seven calories per gram of alcohol, which doesn't sound like it means a whole lot. But if you had 1.5 ounces of, say, rum, vodka, or gin, that 1.5 ounces or that 1.5 ounce shot is at least 100 calories. If you're mixing, let's be honest, I don't know how many times you're actually going to measure out 1.5 ounces. So if you're free pouring again and you're putting in 2 shots, 3 shots, you're now at 300, 400 calories. And that doesn't include whatever you may have added to it. Maybe you're adding juice to it, maybe you're adding a soda to it, but then too, what are you not supposed to be doing? Ideally, you're not to drink juice and you're not to drink carbonated beverages. So alcohol can become a very complicated situation because a lot of the beverages that you ideally shouldn't be consuming are mixed with alcohols. Okay, so you want to be sure to avoid alcohol, ideally for at least the first year. Okay, for the first year after surgery, because that alcohol can irritate the stomach. Again, you have the little egg-sized bypass stomach, or you have a banana-sized stomach. So again, that alcohol can irritate that staple line and cause stomach ulcers, just the same way that we talked about the carbonation and even the caffeine can do. Okay, so you want to be sure to avoid alcohol for at least the first year, keeping in mind that alcohol can also, because your digestive system is much different, you will absorb alcohol much differently, much faster after surgery than you did even prior to. So you'll become intoxicated on a much smaller amount. So avoid alcohol because it'll intoxicate you faster, it will potentially contribute to stomach ulcers, and if you're adding anything to it, whether it be if you would normally add juice to it or if you would add soda or say like a gin and tonic, a tonic water, sparkling water, something like that, you're going to add not only calories but also those carbonated beverages. Again, we're potentially defeating the purpose of what you're trying to accomplish here, and that's to stay hydrated and not take in excess calories. Okay. All right. So ideally within the first year, avoid alcohol. At very minimum, at least 6 months. Okay. Those empty calories that you're taking in with the alcohol. Okay. For instance, if you were to have, say, a margarita or a pina colada mix, okay, those are going to contain 300, 400, 500 calories, even more than that, depending on not only how many you're having, but how large it is. So again, alcohol with all the additives to it, especially if you have a bypass, majority of what's added to mixed drinks is sugar. So you could experience dumping from a mixed drink, in addition to being intoxicated much faster. So not a pleasant scenario for anybody. If you do choose to include alcohol, keep it to no more than 1 to 2 drinks for a male, 1 drink for a female, and 1 serving is considered 4 ounces of wine, 12 ounces of beer, and 1.5 ounces of liquor. So be careful how much you're consuming, keeping in mind that beer is carbonated. Okay. Wine does have some sugar in it in order for it to ferment to become wine in the first place, so that could be problematic for some people. Okay. But then keep in mind too the percent ABV, the alcohol by volume. If you're a beer connoisseur, prior to surgery, a 4% beer is going to have, or for instance, a light beer. 4% beer is typically light beer. In that case, it might have 100 calories. 100 calories doesn't seem like a whole lot, but if you were to have a 7% beer, 8, 9, 10% beer, you're now getting into hundreds of calories. In addition to it being carbonated, so it is not going to feel good in your stomach, and it is going to intoxicate you much faster. If you do choose to reintroduce alcohol, I highly recommend doing so for the first time at home with someone. So that way you're in a safe environment. So that way if you don't feel good, you're in your home and you're comfortable. That concludes our session for today. As a reminder, you want your beverages to be calorie-free, 0 calorie or low calorie, 10 calories or less per serving, per 8-ounce serving. You also don't want to have any carbonation, and you ideally, at least for the first 6 weeks to 3 months, avoid caffeine to avoid the risk of potential dehydration. 48 to 64 ounces is your goal. If you achieve 48 ounces, gradually work your way up to the 64 ounces a day. And then keep in mind that 30-30-30 rule where you're not eating and drinking at the same time, and you wait 30 minutes before the meal and after the meal before you would start drinking again. So thank you very much for your time today.